Alright guys, I'm going to show you really quick how to run quotes on healthcare.gov and to compare them to National General as well as Manhattan Life's affordable choice bundling options that we've talked about in the past, and kind of see for yourself how this makes sense for a lot of people. So I'm going to run this on my own family. We are all very healthy. None of us are pending any surgeries. None of us are diabetic, overweight, anything like that. And so I'm going to run this here. So we're in 38826 Lee County. Are you enrolled in a 2018 Marketplace Health Plan? No. Right now we're currently on Medicare. I am ditching that because I have found some issues with it personally. They like to not approve things that I think they should approve. You know, they have some issues with their community standards, in my opinion. So we're going to go here. We're going to say we have multiple people in our household. You can kind of walk it back. Sometimes I go too fast, but what you want to do first when you go to healthcare.gov is click Get Answers. Go down to this third part here. Where can I find a 2019 C plans, personalized price estimates? And then this is basically just like a calculator for, you know, subsidies and all of that. So we'll say no. You and other people. Yes, I'm married. Yes, I have 2 dependents. I'm going to put myself. Put my wife. Put my oldest son. Or my son, my only son, my daughter, and then I'm going to continue, and I'm going to put just an estimated income in there. We'll go back and play with the income. Say it doesn't appear that anyone has any sort of to be eligible for any premium tax credit. Just to give you, while we're in there, let's just say we made $50,000. Well, then we get a big old subsidy. You know, if I made $35,000, you know, that pretty much pay for a big chunk of our entire health insurance bill. Actually, I think it would put my kids on chips, and then this subsidy would pay for our entire premiums for the husband and wife. But most of the time, or a lot of times, you run into people that don't qualify for that. You know, really, you don't have to have that high of an income. At 100,000, let's say for a family of 4, 125. Boom, no income, no chips, no subsidy, none of that. 125. So, I mean, that's pretty much where it is. So, let's see. Okay. So then let's go back in here and continue on. I just kind of skipped through all this mess. I'm just trying to see prices. So, what I'm pulling up, this is where I'm at, okay? So just to give you an idea, not everything is the same everywhere in the country. We have one company on our marketplace, and Better Magnolia. We do offer them, so I could enroll myself and make about, let's see, what could I make? $48 a month off of my family. So you can subtract 48 for any of these for the purpose of if you're an agent writing it for yourself. But as you can see, this is a catastrophic plan, $13,100 family deductible. The individual is $6,550, $1,269 a month for a very, very young, healthy family. The one that is an obvious pick is for a little bit more. You can get a lower deductible, and you have copays, so that would be better. But let's go over here and check out National General. Da-da-da-da. 38826. They don't make me put in my income, which is nice. Just put in 01/27/1988, 01/12/1990. Make sure you select the spouse, child, female. 11/23/2010, 10/18/2020. 2012. Boom. Say I'm wanting it to start January 1st for 12 months. It'll take me right into another open enrollment period next year. We could make a decision based on, hey, if someone's really sick, now we can look at maybe paying for the $1,300 plan because it makes sense at that point. But right now, I can get my family a $1,000 deductible 80/20 plan with a $2,500 total maximum out of pocket for $338 a month. So you tell me what you would do. Seems like a pretty damn obvious decision. This does not include medicine, and it does discriminate against pre-existing conditions, of which I have none. My whole family has none. So I'm going to save almost $1,000 a month. Not to mention, on the agent side of things, I can get 28% commission on that crap. But even as a street level agent, you can get at least 18 or 20% on it. So I know not everyone you're writing is going to be an agent, but let's just say, for argument's sake, I'm making $67 back of that in commission. So that's not bad at all. If I add that to the cart, there is a one-time $35 enrollment fee right here. If you renew that next year, you check a box and it waives that fee. I'll show it to you here. That always takes forever for some reason. It creates our profile in here, and bada boom, bada bing. I am going to probably do this plan for my family this year. Now I'll show you. Get out of here, Siri. I'll show you the affordable choice option that some people go for. And see, I could actually add this to my plan and still be well under. So say I'm 30 to 39, so base this off the oldest person in the house. I can add this elite hospital indemnity plan here, or classic. Let's say I could do the classic here. For the whole family, $319 a month. Make a good solid commission on that as well. And the $319 plus the, what was the other? $338.89. $319 plus $338.89 would have me at half of what this is trying to charge me. And basically, between the $1,000 deductible plan and a, where is it? And the Affordable Choice Classic, which looks like this, I would have it where if I go into the hospital, it pays out $3,000 the first day, $2,000 a day after that, up to $100,000 that year, in addition to my National General. I would have the ambulatory extra benefits. I would have a small prescription drug benefit, $25 per day. I would have some extra test benefits. So before I met my deductible, I'd have some coverage for that. Have some extra doctor's office, 3 doctor's office visits. Of course, you can up this to the elite and get 4 at $75 a day. Say I go in and I have my lab work done, and this one will pay $75 towards that. The whole dang thing only costs about $125, $130 in cash. I have the extra little emergency room, so if I go to an urgent care center for a checkup, I can have them run that, and it'll pay $125 of it. I went the other day, and in cash it was $130, so that pretty much paid that for me. And it also has a big surgical schedule in it that you can have for extra surgery. So virtually, I could almost make my plan a cover everything plan, and pay half as much. So anyway, and then this is the button you would check to get your $35 enrollment fee waived when you were doing a renewal. And that's it. So that's what I'll be doing with my health insurance this year. I know that that's not a one-size-fits-all, and a lot of different things, a lot of different things can happen. You know, if you're doing let's say you're doing go back to household, edit household. Say you're doing a husband and wife that are we're not claiming any dependents, and we're 62 and 60 years old, and we are making 100,000. Let's say 60,000 a year. Actually, we'll start at 80 just to give you an idea. 80,000, no tax credit. Okay. 50,000, they're gonna get one. 50,000, boom. They're making 50,000. They're getting health insurance for both of them combined for 123 or 123 a month for that plan. For both of them combined. It's astonishing. So makes up for a lot of that lost income there. If they're making 40,000 a year, then boom, they're getting free health insurance. Lowered deductible, free. You know, it's a pretty good plan. Good deal, good deal. If they're making, however, 70,000, boom, nothing. Let's see where the cutoff is. Okay, look at that. If you're making 65,000, you get your insurance for $246 a month for this plan. But if you made 70,000, well, you got to pay $2,000 for it. So all you defenders of the ACA, that's a pretty skewed little thing there. So, I mean, in my opinion, there's definitely some room for improvement on this bad boy. So, anyway, I am going to leave you at that, and I'm going to put this on YouTube and share it with the group, and anybody that has any questions, welcome to reach out to me. Talk to you guys later. Bye-bye.